So first, let's talk about those people who have lost their jobs and what all of this means for them at a time when they need their healthcare the most, assuming they had it to begin with. This is when millions have likely lost access to healthcare or may lose it once their, COBRA provisions expire. They don't have too many choices, right?
Well, this is the fallacy of the whole employer-sponsored healthcare system that we have, where the majority of Americans do get coverage through their employer. But once they lose their jobs, if they do not have a paycheck, which unfortunately a lot of these people that recently filed unemployment do not, then even if they were offered COBRA, which is an extension of their health care plan for which they now have to pay a certain amount and the employer still pays some for up to a year, a lot of these people don't have the means to pay their rent, let alone healthcare. So unfortunately, they're not going to take advantage of the COBRA provision, and the majority of these people will be now uninsured or have to try to apply for Medicaid, which is already an overstretched system in most states, and particularly in those states that did not expand Medicaid, most notably the red states. This is really going to put a strain on healthcare systems throughout.
Now, so ordinarily people would be able to apply, certain people, if they meet the conditions, would be able to apply for Medicaid, but there have been a number of, especially Republican governors, that have refused to expand their Medicaid programs because of a political reason, to basically be against the Affordable Care Act or Obamacare, but no real practical reason. They may be regretting that right now. And also, in addition to that, I understand that President Trump refused to authorize a special enrollment period in order for people to be able to enroll in healthcare.gov online, right?
Yes, so a lot of the states decided to reopen the enrollment in the Affordable Care Exchange. Exchanges, unfortunately, rather than making this federal, President Trump, as you mentioned, has failed to do so, and it's really up to states to reopen this. Again, the problem with that is remember, the exchange provides subsidies for people between 138% and 400% of the poverty level. And unfortunately, as people lose their jobs, they're no longer having any income, and they would not technically qualify for the exchange. If they are not generating any income anymore, then they are technically eligible for Medicaid. But for those people that maybe have been furloughed,